President Biden once again blaming others for his catastrophic failure on COVID. If you want a test, you're going to have to wait. Long lines are the norm as panicked Americans all across the country scramble to find tests, and this could be why. Back in October, the Biden administration rejected a proposal for free rapid tests for the holidays. The president trying to reassure frustrated governors on a video call earlier, but he just wound up blaming them.
Look, there is no federal solution. This gets solved at a state level. Seeing how tough it was for some folks to get a test this weekend shows that we have more work to do. When I took office we were 10 months into the pandemic, and even so, we had zero over-the-counter home tests in the United States. So we got to work. We quadrupled the number of pharmacies offering a free test, and there are now more than 20,000 places where you can get tested for free. For over-the-counter at-home tests, as I said, there were none when we took office, none. Now we have 8 on the market. It's clearly not enough. If we'd known, we would have gone harder, quicker if we could have. We still have tens of millions of unvaccinated people, and we're seeing hospitalizations rise.
And even Dr. Fauci thinks Biden fumbled the ball on testing.
You know, testing has always been an issue, Caitlin, that has been problematic. It has been compounded by the situation of the high demands. We had a conflation of high demands because of the concern about Omicron, which is a justifiable concern, but the high demand that was triggered by the holiday season. Not making any excuses for it. We should have had more tests available, but hopefully now as we get into the first couple of weeks in January, that'll get much better.
And Dr. Marty Makary is ripping into Biden's handling of the situation.
It's disappointing that we're just hearing this sort of political hot air because there's a lot of important things right now that the White House could be talking about that they're not talking about. For one, they need to announce a selective testing strategy. They cannot recommend universal testing with the limited supply that we're currently rationing.
And some big news from the CDC after shortening their quarantine guidance for those who test positive to 5 days. They're now saying the individuals who have received their booster shot do not need to quarantine at all following an exposure, but should wear a mask for 10 days. So, Tyrus, it seems like the government created quite the mess for themselves here.
You know, this is where and again, I'm not a rocket surgeon, but I do read a lot of books. We have been literally being told since this administration came into power that we are all DEFCON red, COVID, COVID, COVID. We can't go to work unless we have tested or we're vaccinated, all these things. So why would we not have stuff? Why would they refuse stuff when their entire pitch this entire administration is that COVID wasn't going anywhere and they were going to be prepared? And once again, fantasy world, the woke administration, they're not prepared. And so what really, and you hate to be the conspiracy guy, I never want to be that guy. So Omicron came on and they're telling you that you had to quarantine for at least 10 days. Lo and behold, you can't go back to work until you get a test saying that you don't have it anymore. So now people have to wait to get back to work. So what else? Lo and behold, the CDC comes out with, we'll cut it to 5. Mm-hmm. If you have your booster, we'll cut it to none. Wow. When are they ever just going to be accountable and tell us the real? What is exactly going on? Instead, it's just more of the same. And Americans are confused, frustrated, and rightfully so.
So, Jason, you know, President Biden campaigned on shutting down the virus, not shutting down the country. And then today, magically, he admits that this is not a federal government problem as he fails to deliver on that promise.
Well, yeah, after beating up for, I don't know, the entire year on places like Texas and Florida and those types of things, voila, it's not a federal problem. Hey, it's you, the governors, you got to do it. Meanwhile, we're going to go ahead and do federal mandates on work requirements, on masks, on airplanes, on all kinds of things. You're going to do all those types of mandates. But you've had 2 years to work on this, Mr. President. Then you come out to the world and say, I forgot to order more masks. Like, you forgot to go to the grocery store and order, bring home the avocados. That's forgetting something. You don't forget to order literally billions of tests. And then you told people on December 2nd that you could go down and get one for free. But that isn't going to happen either. Oh, hey, we've got to wait till January in order to do this. And I tell you what, if you're intellectually consistent, for those of you that were critical of Donald Trump saying on day one that he didn't have enough testing, certainly 2 years into this, you got to take that same position and say, Joe Biden, Kamala Harris, what have you been doing? Because it hasn't been working on COVID. I still don't understand what their plan is.
So, Richard, Biden used this as a political point on the campaign trail. He bludgeoned Donald Trump over it repeatedly. There's tweets of him saying that the president is behind on testing, and yet here we are a year into his presidency with this story in Vanity Fair saying that he rejected this massive testing plan ahead of another variant, which we were told by experts for the past 2 years would eventually happen. What happened there?
Look, I'll give you this. I think that we could all agree that the White House was a day behind and a dollar short, a day late and a dollar short when it comes to testing overall and making sure that every American had access to a test. But with that being said, they think they acknowledge that today. And I think other than that, what you see happening all across the country is that people are able to go and get at-home tests. I was able to go get a home test at my local fire station right here at the nation's capital. But beyond that, I think what was the most news-breaking or newsworthy thing out of today's sort of meeting with the governors is the fact that both Fauci and the president are really interested in switching the definition of how they define the impact of COVID-19. And instead of looking at infection rates, what you see them saying is we now need to be looking towards hospitalizations because the Omicron variant is spreading just so fast that we have to figure out a new way to evaluate how is America going to be kept safe, understanding that we have to live with this virus for some time and understanding that it's impacting our healthcare system and our healthcare workers more so than any other sector. So I'm happy to see that the White House is moving in the right direction when it comes to changing the definition of what they're more concerned about. Less about infections, more about hospitalizations.
They're so
Rachel,
behind the
speaking of those
curve.
hospitals
Oh my
getting,
God.
yeah,
I'm
speaking
sorry.
of the
It's like
hospitals, Rachel,
everybody's
the
known
White
that.
House. Go ahead.
Everybody's known that they've been counting, not counting cases. They've been counting cases instead of hospitalizations. That was their problem from the get-go. Here's what I don't understand. Marty McCary said it very well. If they have a shortage of tests, they should absolutely prioritize those who need it most, the elderly, those with comorbidities. But doing that would, basically expose the lies of this administration. Everybody's going to get COVID. We now know that. And what I don't understand is if everybody's going to get COVID and this variant is very mild, wouldn't this be a great time to start talking about herd immunity, to be talking about early treatments that people can do at home, to be talking about natural immunities? I don't understand why they keep doing jabs only as the only solution to this problem. It doesn't make any sense. If we have limited tests, save them for those who need it most.
So, Jason, back to you real quickly. On this issue of this testing shortage, the government created it by Dr. Fauci essentially telling everybody they need to test before they went home to see grandma and grandpa for Christmas. And now we have all of these people who are not showing symptoms showing up by the hundreds to these testing centers. So didn't they put themselves in this position, especially after rejecting this plan, to develop more tests?
Yeah, you need kids that have to have testing in order to go to school or play in sports. They have to do it on the sports field. They're taking really healthy 20-year-olds and saying, hey, you got to get a test. You know what? If you're overweight, you're over 65, you're in the hospital, you got a morbidity, as Rachel was talking about, yeah, then save the test for them. But not everybody, especially those that aren't showing any symptoms, they don't need to go get a test.
But here's the problem.
Right.
How about if they spread that to somebody who has a comorbidity?
Yeah, well,
I would just say
that's
that
the Biden administration's policy, and they really haven't been able to handle that.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.